Evening everyone. So my next video which I'm going to discuss with you is on the topic critical appraisal of prescription exercise 2. In the previous video I discussed with you the prescription exercise of critical appraisal of prescription exercise of asthma and hypertension. In this I'm going to discuss with you of the primary tuberculosis and H. pylori related peptic ulcer and pulmonary tuberculosis, a critical appraisal. And before I start my video, I want to request you, if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel that is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you the video on critical appraisal of prescription exercise 2. Now, this is the suitable prescription according to DOTS regimen for a case of severe positive pulmonary tuberculosis. The patient age is given, sex is given, diagnosis is given, pulmonary tuberculosis, treatment, tablet isoniazid, 600 milligram OD, this is once a day for 1 month, tablet rifampicin, 300 milligram OD, for 1 month, tablet pyrazinamide 1.5 milligram OG for 1 month, injection streptomycin 750 milligram BD for 1 month. Now this is the wrong treatment given, wrong treatment protocol followed here of the smear positive pulmonary tuberculosis DOTS regimen. Now I will just critically appraise this prescription and then discuss with you the correct prescription. Now, critical appraisal is the format is incomplete. The superscription part is missing. The doctor's name, doctor's details are missing. Patient details are not full. And subscription, doctor's signature and date is missing. And non-pharmacological treatment is missing. Instructions to the patient is missing. Short forms used, means we are using the short forms like tablet, cap, capsule rifampicin, and the dose of 450 milligram should be there instead of tablet rifampicin 300 milligram. Now rifampicin comes in the capsule and the dose is 450. So this is wrong. Rifampicin 300 milligram is wrong. Duration of treatment is wrong. It is the 2 HRZE plus 4 HR. Means for the 2 months, the 4 drug treatments is given, and for the 4 months, 2 drug treatment is given. It should be total 6 months. Dose of drugs used is not correct. Dose of the drugs like isoniazid, rifampicin, pyrazinamide, ethambutol, these are the drugs and the dose is not correct. Pyridoxine as isoniazid is known to cause the neuritis, that is peripheral neuritis. So we have to prescribe the peripheral neuropathy is caused, should be given along with isoniazid to prevent the peripheral neuropathy. Pyridoxine has to be prescribed along with the treatment of 6 months in the therapy. Injection streptomycin is usually not recommended for treatment of pulmonary tuberculosis due to need of daily injections and lower margin of safety. Now, injection streptomycin, it should not be given. Means it will lead to more painful criteria situations, and daily injections cannot be given. And the streptomycin, as it is the aminoglycoside, it is known to cause ototoxicity and nephrotoxicity also. Adverse reaction of rifampicin should be looked for, like reddish orange discoloration of urine should be advised to be not harmful. But if there is orange reddish discoloration is there, it should be advised to the patient that this is not harmful. This is the side effect of rifampicin. Liver function tests have to be done because rifampicin, pyrazinamide, isoniazid, they cause the hepatitis. Ocular examination has to be done because optic neuritis is caused by the ethambutol. Non-pharmacological measures like protein-rich diet, public and personal hygiene should be maintained. That should be specified. Signature of doctor and date is missing. Now, this is how the correct prescription is written. The doctor's details are given here. This is the patient's details. This is capsule rifampicin 450 milligram, tablet isoniazid 600 milligram, pyrazinamide tablet 1500 milligram, tablet ethambutol 1200 milligram once a day for 2 months. It is given, followed by capsule rifampicin 450 milligram, tablet isoniazid 600 milligram once a day for 4 months. Pyridoxine has to be prescribed because isoniazid causes peripheral neuropathy, 100 milligram once a day for 6 months. Observe for reddish orange discoloration of urine. Do liver function test, ocular examination periodically during treatment. Maintain personal and public hygiene. Take protein-rich diets. Sputum smear for acid-fast bacilli at 8 weeks, 16 weeks, and 24 weeks. This is the correct way of writing the prescription for smear positive pulmonary tuberculosis or DOTS regimen. This is signature of the doctor and date. Now, this is how initial phase for 2 months, 4 drugs are prescribed, and in the continuation phase, 2 drugs, isoniazid and rifampicin is prescribed for the pulmonary TB. Now, next is the prescription for a patient having pain in abdomen, suffering from H. pylori associated peptic ulcer. Now, the patient age and sex is specified. Treatments they are prescribed is aspirin tablet, 350 milligram twice daily, tablet ranitidine, which is H2 blocker, 100 milligram twice daily, tablet sodium bicarbonate, which is antacid, 500 milligram, 50 milligram twice daily is prescribed. But for the H. pylori associated peptic ulcer, this is not the treatment regimen. CAP regimen is there, like erythromycin, amoxicillin, and proton pump inhibitor like omeprazole. These are the drugs which are prescribed for H. pylori associated peptic ulcer. This is wrong treatment. So now I'm going to discuss with you critical appraisal. Format is incomplete, superscription is missing, subscription is missing, details of the patient are missing, instructions to the patient are missing, short forms used like tablet. Aspirin is the non-steroidal anti-inflammatory drugs and it inhibits the prostaglandins in the stomach, which are cytoprotective in action. Now, when we prescribe the aspirin for the pain in the stomach, it will lead to inhibition of the formation of the prostaglandins in the stomach that is having the cytoprotective action. Prostaglandins are having cytoprotective action and their formation is inhibited by the aspirin, which is the non-steroidal anti-inflammatory drug. It remains unionized and diffuses in the gastric juice. It remains unionized and diffuses in the gastric juice, but on entering the mucosal cell, it ionizes and causes ion trapping, which causes gastric irritation. Means in the gastric juice, it remains unionized, but when it enters the mucosal cell, it becomes ionized, it gets trapped, leading to gastric irritation. Aspirin particles coming in contact with gastric mucosa also promotes back diffusion of the acid, causing focal necrosis, producing acute ulcers. But they can also cause the back diffusion of the acid, which can lead to formation of the ulcers. Hence, NSAIDs, especially non-selective COX inhibitors, are contraindicated in patients of peptic ulcer. Now, ranitidine or omeprazole are preferred for peptic ulcer. Omeprazole 20 milligram once a day is more effective than H2 blockers in the treatment of the peptic ulcer. This pantoprazole, omeprazole, lansoprazole, these are more effective than the H2 blockers like ranitidine and cimetidine. Sodium bicarbonate, which is the systemic antacid, it has various disadvantages. It gets absorbed systemically. Now, sodium bicarbonate, it gets absorbed systemically and can produce alkalosis. It's a systemic antacid and it will be absorbed systemically and it will lead to alkalosis of the metabolic alkalosis will be caused. It produces acid rebound. It also produces acid rebound. It increases sodium load. it will enter the systemic circulation, and it will increase the sodium load, may worsen the edema and CHF, and hence not suitable for use in peptic ulcer. It is used in the causal treatment of gastroesophageal reflux disease. It can be used in the treatment of gastroesophageal reflux disease and causes alkalosis, acid rebound, and it may worsen the edema and CHF by causing the sodium load. Treatment regimen for H. pylori associated peptic ulcer should be followed. Non-pharmacological measures are missing and signature of doctor and date is missing. But this is how the details of the patient doctor is given on the upper right hand side superscription part, details of the patient. H. pylori associated will be amoxicillin 500 milligram 3 times a day for 2 weeks. TGS is given capsule amoxicillin, capsule omeprazole 20 milligram 2 times a day, half an hour before meals for 2 weeks. Erythromycin tablets 250 milligram 3 times a day for 2 weeks. We have to avoid smoking, taking alcohol, taking tea, avoid spices, caffeinated beverages, avoid oily diet. Follow up after 2 weeks. And then we have to write down the signature of the doctor and the date. But this is the correct regimen of the H. pylori associated peptic ulcer. One antibiotic is given. Two antibiotics are given. Erythromycin, which is macrolide, which is effective against the gram-positive bacteria. Amoxicillin, these are given. Omeprazole proton pump inhibitor is given. Thank you. That's all for my discussion on pulmonary TB treatment, prescription writing, and on H. pylori associated peptic ulcer. Prescription writing. I hope you understood this critical appraisal of prescription exercise 2. Thank you. Be happy, be healthy, be safe, be wealthy, be happy, be safe, happy learning. Kindly subscribe to my YouTube channel. Thank you.